Hi, my name is Zach Kors. Today I'm going to talk about the radial nerve. So to get started, the radial nerve originates from the posterior branch of the brachial plexus, where it goes into the posterior and medial aspect of the proximal humerus, right? So it then exits inferiorly from the axilla to the still on the posterior side to the lateral part of the humeral ulnar joint, where it goes into the radial tunnel, and then it continues down the dorsum of your forearm to the dorsum of your hand, to the dorsum of your hand on the radial side, where it innervates to the first, second, and your third phalanx. These three. Here I have the motor function innervations of the radial nerve. So all these muscles are the forearm extensor muscles, and they're responsible for extending your hand at the wrist, or the carpal metacarpal joint. So they extend your wrist, and they also extend your fingers at the metacarpal phalangeal joint. The other motor innervations for the radial nerve is the three heads of the triceps, which are back here on the posterior humerus, and they are responsible for extending your arm at the humeral ulnar joint. Here I have the sensory areas for the radial nerve. So again, starts at where the triceps would be. Also, the radial nerve starts on the sensory function of it, starts on top of the posterior, the middle of the posterior humerus, which is where you would find the spiral groove on the humerus, and then it continues down the dorsum of your forearm, the dorsum of your hand. So different way the sensory functions for the radial nerve include pain, touch, and temperature. And so ways that you would test a physical assessment on a patient for the motor functions would be if you, for one, had the patient extend at their elbow, extend at the wrist, the humeral ulnar joint or the carpal metacarpal joint, and see if they can actually extend the MCP as well. Other tests would be to have them to test the brachial radialis, which is also innervated by the radial nerve. You would have the patient put their arm out and have a little bit of resistance in the middle 2/3 of their forearm, and ask them to flex their forearm, and that would test the brachial radialis. You can also test thumb abduction, which is a way to extend the thumb, and if they can't do that, then maybe radial nerve damage. For sensory function testing, you can have them do a 2-point discrimination test, which would be if you touch two different points where the radial nerve is supposed to give sensation. If they can distinguish between the two different points, then the radial nerve should pass the test. It should be negative for radial nerve damage. Other sensory tests would be if the patient senses any tingling or numbness along the dorsum of their forearm, or dorsum of their hand, it can also indicate radial nerve damage. So The thing with these, if there's an injury of the radial nerve closer to the axilla, so closer to the proximal humerus, then it's more likely from this area that there may be weakness in the triceps, which if there's weakness in the triceps, then they wouldn't be able to extend their elbow. And there may also be weakness in numbness and tingling sensations felt. If the injury is closer to the spiral groove, so more in towards the middle of the posterior humerus, then there may be weakness in the brachioradialis, which is where you would do that, and you would just, if they can flex at their elbow. If the injury is closer to the posterior interosseous nerve, which passes through the arcade of Frosch, there may be difficulty extending the fingers because of the forearm extensors. So with all of these, they can be caused by trauma. All these instances of radial nerve damage can be caused by trauma, or it can also be caused by what's called Saturday night palsy, honeymoon palsy, or crutch palsy. So Saturday night palsy is when it's called Saturday night palsy because people who might be under the influence may find awkward, unnatural ways to rest their arm to go to sleep. Awkward, unnatural ways to rest their arm when they go to sleep. So they may put too much compression on their arm, which may lead to compression of the radial nerve, which can damage it. They can also have honeymoon palsy, where the honeymoon palsy, the partner would rest their head on the arm of the patient and through the night would compress the arm and compress possibly the radial nerve, which could lead to damage. And there's also crutch palsy, where crutch palsy is a patient that's already in crutches and they're using the crutches to walk either too forcefully or too much, too often, and that that crutch can compress at the axilla, and that's why it's called crutch palsy. It compresses at the axilla. So all of these types of palsies for the radial nerve can cause what's called wrist drop. And I have an example of wrist drop here. This is pretty cool. This is from a YouTube video that I saw. So this patient was actually unable to extend at the wrist and extend the fingers at the carpometacarpals and the phalanges, but she could extend her at the elbow joint. And they actually did do the brachioradialis test, and she was, she didn't lose much strength in her brachioradialis. So that all those different kinds of palsies can lead to this wrist drop situation. Thank you for listening to me. Have a good day.